All right, we're going to go ahead and get started. Thank you, everyone, for coming and attending. I know it's pretty early for most of us, so I appreciate it, especially as it's getting darker in the morning. But as Denise said, daylight savings time is ending, and at least it'll be lighter in the mornings. And yeah, so just as a reminder, Davis Links is a monthly resource forum currently, and we are going to be talking about something very important, which is resources for people who are underinsured or uninsured. And I will be giving an overview of the topic. I'll also, at the very end of this forum, be talking about important announcements, so make sure you stay on. And of course, I'll send those out as well after the fact in the follow-up email. And also a reminder that these recordings are now being housed on our YouTube channel, which I'll, again, at the end, share a link to. But also in the follow-up, you'll get that. Just to conserve space on our drive, it just makes more sense to have these recordings, the virtual recordings, on there. And we also have great speakers today, people from Take Care Utah with the Utah Health Policy Project. We have Midtown Community Health Center, and we also have Salt Lake Donated Dental, which is also representing Davis County. So excited for the lineup that we have here, and thank you to the presenters for being willing to come. And so I am going to go ahead and get started with my portion. Okay. And hopefully you can see that. I'm going to Okay, good. It's on the screen. So, like I said, my name's Travis Olson. So I am a community outreach planner with Davis County Health Department and currently helping lead this Davis Links resource forum. And as I mentioned, I'm going to give an overview of health insurance on this topic. So really the objectives: what is health insurance? Why does it matter? What are the strengths of and opportunities to improve insurance rates for adults and youth in Davis County? And what is the community experience with barriers to health insurance? So I'm just going to mention that I have a couple of data sources that are informing this presentation. We've got the Utah Healthy Places Index. So that is a mapping tool that mainly looks at indicators that are positively associated with life expectancy, and that's specific to Utah. And then it also has other decision support measures. So we'll talk about that later. And then also Adam Grimaldo gave a presentation. He's from the Healthy Horizon Insurance Agency. You may recognize his name. He presented at the last forum about health insurance, so I'm also borrowing from that as well. Okay, what is health insurance? Just to review, a contractual agreement with a health insurance company where the consumer pays a premium and health insurance company covers medical services. And why is it important? Ultimately, everyone should have access to medical care when they need it and to keep their bodies healthy with regular checkups. And research indicates that health insurance dramatically improves health outcomes by allowing people to access necessary care. Specifically, what are those benefits? So first, it allows people to receive ongoing, consistent care and establish ongoing relationships with medical providers, which is so important. Enables them to get regular screenings and checkups. That's helpful for early diagnosis and reduced mortality from cancers and other diseases. And people with insurance are far more likely to get medicines to control their chronic diseases. Also, insurance access has community-wide impacts, reducing the spread of communicable diseases. And health insurance helps families save money on expensive medical care. About half of bankruptcies in the US are due to medical expenses. And one study found that uninsured families can only afford to pay 12% of hospitalization costs. And in a bit, I'll talk about how our community has been impacted by that. Okay, where can people access insurance? Just to review, they can get it through their employer. They can get it from a private health insurance company, their student, through college insurance, Medicare, which is mainly for those that are 65 years of age or older, as well as younger adults with disabilities, and Medicaid, which focuses on different groups, including those that are low income, and health insurance marketplace, so our government insurance. Okay, so what are the primary barriers to receiving health insurance specifically in Utah? That would be eligibility and cost. So one thing to note, that Utah has been steadily improving health insurance coverage over the past decade, so that's a great thing. 1 in 10 Utahns are still not covered though, and undocumented people face special challenges due to ineligibility for many programs and the fear of deportation. In addition to eligibility and costs, it's important to note that there's a need to help people understand the options that are available, so navigating the system, which is complex for all of us to do. Okay, I'm gonna now talk about community lived experience. So we at the health department interviewed 76, or rather interviewed, not interviewed, but conducted focus groups with 76 Davis County community members in 9 focus groups back in the summer of 2022, and most identified as underserved or underrepresented in some way. We had groups such as people with various disabilities, Spanish-speaking focus groups, LGBTQ+, and others. And participants identified a number of barriers to health insurance access. One of which, again, just as we talked about for Utah, locally, the cost of healthcare for mental, behavioral, and oral care. So either not having insurance or needing services, including emergency situations, that insurance does not cover. And then also eligibility barriers, again, similar to the state. So in terms of this, eligibility barriers to getting insurance due to immigration, employment, income, and disability status. So one of the people in the focus group shared a story about their daughter who had an emergency health problem and stayed in the hospital for 2 days. So because of that, they received a bill for over $20,000. Medicaid and financial assistance through the hospital did not provide any support. So the family was forced to sell their vehicle and was still paying the bill 10 years later. You can just see the long-term impacts of not being able to afford the services, and sometimes insurance just doesn't cover those things that people need. And wanted to mention that it's important to consider people experiencing a sudden and significant reduction or loss of benefits as their income increases slightly or crosses a certain threshold. That's also called a cliff effect, if you're familiar with that. And I'm going to read a quote from someone that participated in the focus group. So they said, "I'll just speak on behalf of parents. When parents have a medically fragile child, they will take a lower income job, or they will refuse a raise so that they can still maintain an income that qualifies for Medicaid. And that is across the board problem I've seen over years and years and years of doing this. That's a huge sacrifice that I can't take a promotion because I might lose my Medicaid benefits. It is a terrible strategy that they have to watch those financial lines so that they don't lose those benefits that they depend on for life." Great point, and just to difficult situation. Now I'm going to move into what insured adult rates look like in Davis County. So what you're seeing on the screen, or if you're not, I'll describe what is on the screen. So on the left-hand side, we have a map of Davis County and the cities. On the right-hand side, it's a map of the same area, but it's census tracts, which are smaller areas, just to compare the two. And as a refresher on the Utah Healthy Places Index, the blue on the map indicates that they are less healthy community conditions, and then that goes up to green, which is more healthy community conditions. These are percentile rankings, meaning that they compare across the state in terms of either whether they're cities or whether they're census tracts, whatever geography, it's just comparing in order to identify gaps or opportunities. I'm also going to share specific values or the percentages so we can get an idea of what the gaps actually are as well. And so on the left-hand side, again, I should mention that this measure is talking about the percentage of the population aged 20 to 64 who, are insured. And you can see on the left-hand side, maybe if you're viewing the screen, the areas of strength is that the county insured adult rate is 92.3%. This isn't on here, but just so you know, the county is 92.3%, and that's better than the state of 88.5%. Okay, now actually jumping on to the map, and again, this is showing percentiles. I'm going to be talking about the percentages, which you don't see on there, but Central Davis cities have rates above 95%, which is great. Syracuse and West Point have rates over 97% of adults covered by insurance, and South Weber has over 96% rate. And at a census tract level, there's similar rates for some of the tracts. Over 78% of people aged 20 to 64 are, sorry about that. That relates to something else, but that's the strengths. And then as far as the areas of opportunity for improvement, Sunset has a 76% insured adult population. Woods Cross City has 85.6%, and Clearfield 88.7%, which still, I mean, like Clearfield is just slightly better than the state. So that's something to keep in mind, that those are areas where they were a little bit lower. And at a census tract level, pockets in North Layton and the Clearfield and Sunset areas, as well as South Davis County, are below 85%. So just some areas to think about. And there's notable disparities in insured adult percentages at a city level between white alone, those that are white alone, not Hispanic or Latino, compared to other populations. So in terms of comparison between white, non-Hispanic to Hispanic or Latino populations, in Sunset City, there's a 30% gap in insurance coverage. In Layton, a 20% gap. Bountiful and also Woods Cross, almost a 20% gap. And Clearfield is a 17% gap. And then compared to those that are Native Hawaiian and other Pacific Islanders, North Salt Lake has a 37% gap in insurance coverage for adults. Syracuse, over 33% gap. Bountiful is over 14%. Now comparing to American Indian, in North Salt Lake, there's over a 40% gap, and Layton over 15% gap. And then lastly, compared to the Black and African American population in Davis County, so in Clinton, there's a 19% gap. Farmington over 18% gap, and Bountiful over 17% gap. So it's just important to note these things. And by the way, this isn't to place blame on individuals. This often reflects the socioeconomic conditions in our county and larger, even broader, that affect our county. So not an attempt to blame or place individual responsibility, but more just like reflecting that there's broader policies and things like that that are affecting this. Okay, so now I'm going to talk about insured children in Davis County. So there's a similar pattern. By the way, this shows a different color scheme because it's not included as part of an index, which is the actual indicators that were used to create a combined index score for the different areas. So you'll see that, or if you don't see, on the lower end of the scale, so that is like lighter blue, and then all the way up to purple is more, and indicating more insured children. And one thing that is great is that the county insured children rate is 95.2%, which is much better than the state, which is 78.6%. So that's a great thing for the county. And just keeping in mind also when we look by city or by tract, there are also areas for opportunity, but we can follow the same lines as the adults insured rate. So I'm not going to go too specific into that. And by the way, this measure is the percentage of population 18 years and younger covered by any type, private or public, of health insurance. I'm also going to talk about adult employment in Davis County because being employed impacts insurance, or can impact insurance. So again, on the left-hand side is an image of the cities and towns on that geographic level, and then on the right, the census tract level, and both are showing employed rates. So this is measuring the percentage of the population that are aged 20 to 64 who are employed. And stable employment allows people to afford the goods and services that are necessary for good health. Again, just like in having the insurance through your employer can be a really helpful thing. And in terms of strengths, over 78% of people aged 20 to 64 are employed in Davis County, which are slightly better than the state rate of 77.9%. And cities in South Davis have higher rates than the county. Centerville has the highest in the county at 84.6%. The Syracuse rate is percentage is 83.2%. And at a census tract level, some are 86% or higher. So that's great. Areas of opportunity in Clearfield, it's 70.7%. Farmington is 73.6%. And at a census tract level, a few tracts in Clearfield have employment rates below 70%. Again, this isn't to place blame on cities or anything, just as a way to identify potential gaps that could be improved. And now I'm just going to compare adult employment insured adults in Davis County at the census tract level. So you've seen both of these images, or I've included them in the past and talked about them. So on the left-hand side, it's talking about insured adults, and on the right-hand side, it's showing employed adults. So just wanted to show that, there is a pattern between being employed and being insured. I just lastly want to talk about important enrollment dates. So for Medicare, the open enrollment period starts October 15th. Well, actually, it did start already, and then it ends December 7th. And then the general enrollment period for it starts January 1st, 2025, and ends in March 31st. So Marketplace open enrollments, the government insurance, the period for that starts November 1st of this year and ends January 15th. And then special enrollment period is something that's all year round. To be eligible, you need to be below 150% of the federal poverty level. Does anybody have, I know that was a lot of data, a lot of stuff being shared. Does anybody have any questions? Okay. I am going to now turn over, let's see if Oscar is here. Sure. So actually, I think we're going to adjust the schedule, which is totally fine. So I'm going to have Denise Jones, which is a health access assister from the Utah Health Policy Project, also representing Take Care Utah, talk about the resources that they can provide to the county community members. So Denise, take it away.
Thank you, Travis. I am Denise Jones. I am a health access assister for Take Care Utah. So, Take Care Utah is a program of UHPP, Utah Health Policy Project, and we help people navigate the healthcare system, and we provide access to health insurance. We currently have about 30 health access assisters, and we have two linkage coordinators, and I'll talk about them briefly. And we provide services throughout the state of Utah. We have offices in Ogden, which is where I am. Our largest office is in West Valley. We also have staff in Logan and in Orem. Excuse me. So at Take Care Utah, so we provide outreach in the community through recurring sites. So we go out and meet people where they are. Often we're in the jails, we're in libraries, we're at reentry fairs, we're at some markets, excuse me. And we also attend events that are hosted by similar organizations. Um, we provide free one-on-one application assistance to our clients, because often we get clients who feel that the Medicaid process in particular is overwhelming. And so people can make appointments either online or they can walk into our offices and we will help them complete these applications. Um, We also connect people to primary care, which we call coverage to care. So once a person has secured Medicaid, we walk them through the process of choosing a healthcare provider, and we often put them in contact with a health representative who can help them look at the different insurances, whether it's U of U, Select Health, that sort of thing. Um, we provide education on how to access these benefits that come with Medicaid. Um, and that's often through, conversations that we have. We, let them know the process for setting up a My Case account. It's where they can, where DWS houses all of their information. Um, we provide vaccine outreach. We generally take materials or resources to these events that we attend, and let people know that these resources are available for vaccines. We make referrals to other agencies. Um, other relevant agencies, because sometimes we may get people who qualify for more than just Medicaid. And so we can refer those people. So some of the common programs that we work on are adult expansion Medicaid, and that's what exactly what it sounds like. It is a Medicaid program for adults over the age of 19. There's family Medicaid, there's CHIP, there's targeted adult Medicaid. So that is for people who are involved in the justice system. And we do quite a bit of work with like reentry folks. We go into the jails um, and see people who are being released within the next couple of days. Um, we also work with people who qualify for age, blind, and disabled Medicaid, also referred to as ABD. Um, we work on the pregnancy Medicaid and emergency Medicaid as well. Um, let's see. I'm sorry. So I mentioned that I was going to talk about the linkage coordinator project. So we have a couple of people in our West Valley office that provide additional resources to people. And usually those are adults with intellectual or development disabilities, mobility limitations, and TBIs, traumatic brain injuries. Uh, our clients must be 18 or older and a Utah resident. So they work to identify unmet health needs with this client population, helping them to overcome barriers to accessing healthcare and living a healthy life. Um, Participants can earn up to $75 in gift cards. And if anyone is interested in that link, I can provide it later to Travis. I also wanted to mention that, in our work, our numbers recently, in 2023, we helped enroll more than 12,000 individuals in the last year. We contacted over 75 people through our direct outreach, and we've attended more than 1,100 events to help raise awareness. So we are out in the community, again, meeting people where they are. So our clients can reach us through making appointments at takecareutah.org. Um, Also linkage referrals, and we also have a site for um, vaccine outreach and educational tools. And I think that brings me to the end of my presentation. I'm sorry, it wasn't as long, but if anyone has any questions, please feel free to contact me. Oh, I did want to mention that tomorrow we're having our annual enrollment summit from 9:30 to 1, and it's virtual and free to all registrants. Um, yeah, so if you're interested in attending that, I'll also provide a link. It's not too late to register. Thank you all.
Thank you so much, Denise. Does anybody have any questions, comments? See if there's any in the chat. Oh, Lindsay, sorry about this. So do we know if the coverage is Medicaid versus marketplace plans?
Yes,
So,
oh,
yeah.
oh, so
Go
what
ahead.
was, so I'm sorry. So we also do work with marketplace. And so if a person's income is above the federal poverty guideline for Medicaid, we can direct them to marketplace. We have licensed brokers, so forgive me for not mentioning that. We have licensed brokers who help people sign up for um, marketplace. Again, they can make an appointment. Our brokers will walk them through the entire process and help them select a plan based on their individual health needs. Or, you may be a young person who doesn't need like who doesn't see the doctor that often and is in relatively good shape, good health. And so, the um, our person can, guide you through the entire process. So again, Travis mentioned open enrollment. So we are already busy with scheduling appointments for open enrollment for Marketplace. If anyone needs those dates again, please let me know.
Thank you, Lindsay. I'm not sure if you were asking about what I was talking about,
Oh,
or yeah, with the insurance plans. But yeah, so the first one I was sharing, in case that was what it was about.
okay.
Yeah, so it's Medicare, open enrollment, and then Marketplace. It didn't include Medicaid as part of that. So I'm not sure what the dates are, but Denise, if you know better, like when Medicaid enrollment happens, and if not, that's okay. I know I'm just putting you on the spot. But
You both answered my question. That was wonderful. Thank you.
okay, great. Thanks, Lindsay. Does anybody have any other questions for Denise? Okay, we are, our next person is going to be joining. There was something urgent that came up, so they'll be joining in just a second, but I think I'll take this
You're
time.
talking about me in here.
Oh, perfect.
So if you're ready for me, I'm ready.
Okay, yeah, sounds good. So Sasha, that's you, or are you
Yes,
on a different?
that's me.
Okay, it says Alexandra Harvey on there, so that's why I was confused.
No worries.
Okay. All right, so Sasha's gonna talk next, and she again is with Salt Lake Donated Dental Services. She's the executive director there, but she's also representing Davis Donated Dental. So I will let you take it away.
Perfect. And do you
And also, I'll share this.
Okay, awesome.
Yep.
I appreciate
Thank you
it.
for reminding me.
Of course. Thank you, everybody. My name is Sasha Harvey. It is a little bit confusing that it says Alexandra Harvey. Alexandra is my legal name. For some reason, Sasha is the short form of Alexandra in Russian. I'm not sure why. But I'm the executive director of Salt Lake Donated Dental Services, and I just wanted to share some information about Davis Donated Dental Services Clinic that we have in Kaysville. A little bit of history about our clinic. It started in 2012 as a program run by a local food pantry. At the time, the executive director there, Lorna Kosai, identified the need for dental care in the population that they were serving as the food bank, and started out this small, very part-time program in partnership with Davis Technical College that has dental assisting program on campus. It's a collaborative effort where we as the nonprofit know the population, we provide the patients, we recruit volunteer dentists to come and donate their time and skills. And the Davis Technical College offers a beautiful facility with dental chairs and dental assistants that are going through this program and learning skills that they need to be successful in their future careers in dentistry. Eventually, this program has changed the name to Pantry Smiles and started growing. I think as many donated dental projects that begin as just an effort to fill the void temporarily. The realization came that the need is there and it's ever growing, and there's so many people that just don't have access to care, whether because of the transportation, language barriers, or most often the cost of care. The void that was identified is being met also by Weber State University Dental Hygiene School that comes to our clinic and does a rotation there. So the students that are going through dental hygiene schools are doing cleanings for the patients. They're talking about oral hygiene instructions. They're educating them on how to prevent dental disease and how to take care of their existing conditions. So eventually, at the beginning of 2023, this program just outgrew itself and decided to join forces with Solid Donated Dental Services that has been around for about 34 years now. We started partnering together, and now we're known as kind of one organization with two locations, one in Salt Lake, one in Davis County. The services that we provide are for patients 150% of the federal poverty level or lower. They do have to be Davis County residents. All the services are provided at no cost to the patients. Our schedule is very limited still. We have about 4 half days a month for treatment and 2 days a month for dental hygiene services, which allows us to, again, concentrate on preventative and restorative services, not just doing emergency treatment. Hopefully, we're just moving the needle in the right direction a little bit at a time. The services that we do provide are dental exams, x-rays, fillings, extractions, crowns, occasional bridges, partials, dentures. What we don't do is complicated extractions, complicated root canals, which are right now referred out to specialists in the community that have agreed to help out our patients at their own clinics. So again, if there is a need for the patient to get those services done, they might not be seen at our location at Davis Technical College, but we will find a way for them to complete their treatment plans. Our main referral partners that send patients to us are still the Community Food Pantry in Bountiful, Smart Smiles, which is a program that works with with local schools and provides dental services for the kiddos. Davis Technical College, some of the students qualify for our care, and it's nice to be able to be a dental home for them right there in their own backyard. Safe Harbor, Red Barn Academy, Davis School District and Head Start, Senior Charity Care and Dental Corps, Midtown Community Health Clinic, and Dental Lifeline Network. Because our services are so limited in terms of our capacity to serve the patients, we don't actively advertise our clinic. Most of our patients come as referrals from other community organizations. We're hoping that there will be opportunities for us to grow this program and meet the ever-growing need. We are always looking for volunteers, so if any of you have your dentists who are looking for a way to give back to their community, it is a very meaningful way to be a part of this life-changing services that we provide. It is really not just the aesthetics. It is not how your teeth look. It's about nutrition. It's about your confidence. It's about heart disease and prevention of diabetes and other medical conditions that are closely linked with oral health conditions. So if you are a dental professional or if you know somebody else in the community who is, we would love to partner with them, dentist or hygienist. If they want to give a few hours, it will make a huge difference in someone's life. I'm going to pause here and see if anybody has any questions. So the information for our clinic is listed on this last slide. This is our address, our phone number. If you do have patients that are low-income individuals who are in dire need of dental care, we're happy to help them. So you can refer them to our clinic.
Thank you.
All right, sorry about that. I had Denise pinned for everyone, so I thought I had put you as the pin. So anyway, thank you so much. Again, if anybody has any questions or things that come up in your brain later on, then you can go ahead and put them in the chat. And let's see here. Oscar, are you here? I sent him an email, so it could be that something came up. And if that's the case, we can give him time, and I can go ahead and give kind of some of the announcements that I had. So one of the things I wanted to share that's very important is our next forum will be November 26th, the last Tuesday. That's 2 days before Thanksgiving, just so you're aware. It is going to be in person in room 131, where we normally meet in the Davis County Administration Building in Farmington. And we're excited about this. It's going to be a rollout of a resource. It's going to be a soft launch where partners can look at this resource directory that's being developed online. And the goal is to make it as comprehensive as possible so that people can access needed resources and services. So, for instance, those that we just heard from, making sure that people can get that information, and also that partners can help the community navigate it as well, and to refer out. There will be a referral option as well for people to give to partners and have that warm handoff. And so more information will be available on that day, but we are going to be starting at 8:15 and not 8:30 because we are providing a breakfast for you all, and it will be a good one. So we hope that you can attend that one. And in preparation for that forum, we're going to be hosting 3 trainings. So let's see if I can pull up the flyer. Let's see here. Okay, so it might be a little bit hard to see, but this is the flyer for 3 different trainings that will help prepare providers for November 26th. Now, as Davis Links members, you don't necessarily have to attend these trainings, but your agency is invited, like it says, to attend those 3 trainings to become familiar with the Davis Links Resource Directory. We have contracted with a platform called Find Help, something actually that United Way in Utah also has done. So we're kind of moving in a similar direction. And a Find Help representative that we've been working with will provide training about the features and uses of the platform and answer questions. And attendance at each training is encouraged. So all trainings are going to be held on Tuesdays, so the first 3 Tuesdays of the month. And, oh, thank you, Marcy. So there's a link to the Davis Links community trainings and for you to register. So this is for people that in their agencies are going to be referring people who are going to claim different resources and programs and that kind of thing. Again, attendance at each training is encouraged, that isn't required, and all trainings will be held, like I said, on Tuesdays from noon to 1. So again, just trying to keep things clear. So those first 3 will help prepare for the Davis Links regular resource forum on the 26th. All are going to be on Tuesday, but the first 3 are going to be from noon to 1, and they're going to be virtual, and the actual forum itself is going to be in person, and it's going to be our regular time, but we are going to start at 8:15 again because we are providing breakfast. So Marcy just shared the registration link. Many of you have already registered. I sent that email out about a week and a half ago or so. Maybe it was a week. But yeah, so if you are interested in attending, or if you know someone that may be a good fit for this, we recommend that they join. So Jennifer, so if we are going to the 26th Davis Link, should we still go to the other trainings, 3 trainings? If you are going to be kind of a person that's in this system, helping people navigate it, helping refer out, that kind of thing, we do encourage you to look at these, because we actually just uploaded, or working to upload like 1,300 different resources that we have compiled from partners and internally with the health department. And of course, this is going to be a phased approach and an ongoing thing. So this is a soft launch, but if you, and kind of like, okay, to give you an idea of what those trainings are. So Search and Refer is the first training. So becoming familiar with the Davis Links Resource Directory and learning how to make a referral. And then the next date on November 12th, the suite of tools for programs to learn about resources that are available once your agency has claimed your programs in the Davis Links Resource Directory. And then the third is community engagement best practices. So agencies who have claimed programs can ask specific questions and learn about education opportunities, best practices, and resources. So it is recommended if you are going to be there at the November 26th, because it will help prepare you for that, but is, again, not required. Another thing that we're going to be doing that's unique for November 26th, our regular forum, is that we're going to be rolling out the branding. We consulted with someone who provided us with updated logo and our images, recommendations around that, fonts that we use, colors, that kind of stuff. So you will see our webpage change, as well as the link to it will change, and that kind of stuff will be shared at the November 26th training. So it will be a little bit different, and like I said, at the November 26th, people have an opportunity to work through things, and like if they didn't attend these other trainings, to learn how to claim the program that's been uploaded, and Find Help works with agencies to help them just to verify that their program is current and accurate, but organizations claim that resource, and that'll make more sense of the trainings, because that might not make very much sense right now. But if you have registered already, and if you have not and plan on doing it, you'll be getting an invite, a calendar invite from Isa Perry. So Isa, daviscountyutah.gov. And so it's not coming from Davis Links, but you will get, if you do register for the regular form on the 26th, which is a separate registration than these three trainings, you will be getting it from me, Travis Olson. So I know that's a little confusing, and I haven't opened registration for that training or for that resource forum, just to help with confusion. So I'm not opening that up for the regular forum until next Tuesday, a week from today. But you can register right now for these three trainings. Isa and Marcy is also on the call. We're all working together in a coordinated effort. So, if you have questions and you ask me, even though Isa is looking out, is kind of like providing a calendar invite, and if you have questions, you can contact her, you can contact me, you can contact Marcy Clark. So there are multiple people if you have questions. We're excited for this. The online resource directory is a big effort and a push. It's part of our community health improvement plan process, and making sure that people have access to resources and services. And of course, we'll still need community connectors and people who can help them use that information. But this is another step forward in having Davis Links be broader than just a resource forum, to include other things as well. So more information will be available in those upcoming trainings. Does anybody have any more questions? So registration is open for these first three trainings, the first 3 weeks of November, and they do have different topics. And then the fourth Tuesday, which is the last Tuesday of the month, registration will open next Tuesday. Yeah, I know that was a lot. So if you have any questions, let me know, let Isa know, let Marcy know. We are all happy to help you. Okay, I just want to check and see if Oscar is here. And I'm not sure if Oscar sent somebody else from Midtown to help represent. So if you are representing, please let me know. Okay. Well, we'll send out resources still regardless with Midtown Community Health Center. They do a lot of great work. They do, while they don't run this, they also like help host in their facility for an ongoing volunteer clinic where medical professionals help the community members get access to help that they need to. And they work a lot with people in terms of Medicaid and other types of insurance. And it is a little bit of a different model than your regular health center. And it is geared for those that are low income. And it's actually, if you haven't seen it, it's in the Davis County one is actually in the same building as the health department. Is on the first floor. So Oscar is an amazing person and can help get people connected to resources and Medicaid and CHIP specifically as well. And yeah, so I can't answer everything about Midtown, but I'm sure he can follow up and we can get more information about that. So I'm going to share the forum evaluation with you all to complete. Okay, so that's the post-forum evaluation. And we do recommend that you complete it so we can improve our forums. I know this was a little disjointed, but we roll with whatever, comes up, and I'm sure something came up. So again, thank you so much to our presenters. Hopefully you learned more and have takeaways that you can use to help these populations. And again, just appreciate everyone attending. And if there's nothing else, then we're going to wrap up early. And like I said, just watch for emails. I am going to, in the follow-up, talk about these 3 trainings again. And then also, and next week, I'll open up registration for the 26th training, or I guess soft launch of the online resource directory. Okay. Well, thank you so much for everyone again in attending, and I hope you have a great day, a great week, and we'll stay in touch. Thank you.
Thank you so much, Travis. Have a good day.
Bye.